Briskly, for a mere 11 minutes a day, you will drop your breast cancer risk by 20%.
The prevention tips, the cutting-edge treatments, even the breast cancer facial.
I feel alive, you know? I feel really alive.
Beat the biggest health battles, all new on The Doctors.
Coming up, how one breast cancer survivor turned to the one doctor she trusted the most, her own husband.
Coming up.
I felt like I was a walking corpse. And as chemotherapy progressed, I started to gain weight. I had no hair. I didn't feel feminine. I didn't feel pretty.
These treatments help to improve the texture as well as the color of the skin.
He brought me back to life with all his lasers.
And chemotherapy, it doesn't only affect a woman's hair, it can also make a huge impact on a woman's body and overall health. This was the case for Amy, a breast cancer survivor who says her year-long struggle sucked the life out of her, so she turned to the one doctor she trusted most to rebuild her confidence, her husband.
I was diagnosed with lobular breast cancer a week before Thanksgiving, 2010. It was discovered by a routine mammogram. And before you knew it, I had scheduled a double mastectomy for December 1st of 2010, my 51st birthday.
Unfortunately, at the time of surgery, they detected that the cancer had spread to one of the lymph nodes. It meant that she would need chemotherapy.
And as chemotherapy progressed, I started to gain weight, and that was a real bummer. I had no hair. I didn't feel feminine. I didn't feel pretty.
There was a sallowness to her complexion. Her skin became more irregular. She developed wrinkles that she really never had, brown spots on the skin.
I felt like I was a walking corpse.
This is the third in a series of Fraxel Restore dual treatments that we'll be providing for Amy. And these treatments help to improve the texture as well as the color of the skin. So she'll see improvements in fine lines, in wrinkles, in pore size. She'll see the brown spots that developed all fade away to nothing.
He really helped bring me around so fast. He brought me back to life with all his lasers.
It really is important for people to take care of themselves, to put makeup on, to go for cosmetic treatments during the process. It's been shown that a positive outlook absolutely affects the immune status of a person. So someone feeling good about themselves during the process of cancer treatment is a big, big factor. How you doing? Give me a smile. She rose to the occasion, and we were led by her positivity and her spirit, and she made it easier for us.
Please welcome cosmetic laser specialist, Dr. Mitchell Chasen.
As a doctor and a husband, how did it feel to watch your wife go through this?
Yeah, it was very difficult, but at the same time, you feel good being able to help your family member, and with the technologies we have today, even simple treatments, a woman can really do things for themselves and feel better about the way they look, and that in turn makes them feel better about
I know, I want to see Amy. Do you all out there want to see the new improved Amy? All right, let's take a look how Amy looked before her treatments. All right, Amy, come on out. You look fabulous. How do you feel?
I feel really great. My husband brought me back, and I am just so grateful for that. He brought me, made me feel like myself again.
So, Mitch, tell us exactly what you did for your lovely wife, Amy.
Well, we wound up performing a series of Fraxel treatments. We did all therapy to tighten her skin. We used Botox to treat those frown lines that unfortunately she now had. And we used Juvederm to replenish the volume that Amy lost in her cheeks. So it was a busy weekend, needless to say.
And you're going to show us the laser portion of what you did for Amy,
absolutely.
Right?
So the first thing we're going to demonstrate is the B-beam laser, which is something that targets the red blotchiness that women develop in their skin during chemotherapy or illness. And people think of lasers as dangerous, as what's it going to do to the surface of my skin? And the whole point of a laser is that it goes right through the surface to a target underneath the skin. And this little demonstration here is going to show that the laser is going to go through the white balloon on the outside, and it's going to target the red balloon on the inside. And if all goes well, we'll see the red balloon deflate, and the white balloon should stay intact. Lasers are very safe for the skin, but we need to protect our eyes. So everybody, in the audience and up
Here we go.
on stage.
So that gives us an idea how you're taking that redness out of that
Absolutely.
skin as a result of that chemotherapy.
Absolutely. The next laser we'll be using is the Fraxel Restore laser, a laser that revolutionized the industry several years ago. And the key to this laser, again, we're delivering energy underneath the skin. The energy is delivered deep down, we stimulate collagen, we remove unwanted pigment, and the skin becomes smoother, more youthful, and it's something that patients just love. So this demo will show that the energy is delivered in tiny little pixels like we notice in a photograph. And again, the surface of the skin completely intact. But underneath, we'll notice the energy has impacted the skin way down deep where it's most effective.
Well, it sure worked for your lovely wife here.
Yes, she looks fantastic.
Thank you so much for coming, the two of you.
Thank you for having me.
Best of luck.
Thank you so much.
Thank you so much.
Thank you so much.
Thank you.
Coming up.